Okay, thank you very much. Merci, Eric. Hello,
Thank
everyone,
you,
and
Eric.
thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Brigadier General Krista Brody, Vice President of Operations and Logistics at the Public Health Agency of Canada. And to assist us in answering your questions, we have with us Joelle Paquette from Public Services and Procurement Canada. This week, Canada's vaccination campaign has continued to soar. As of today, more than 19.6 million doses have been administered. It is very encouraging to see that over 55% of the eligible adult population in Canada has rolled up their sleeves. As of May 16th, there have been 34 reports of blood clots with low levels of blood platelets following immunization in Canada with the AstraZeneca or Covishield vaccines reported to the federal level. Of those, 21 have tested positive for PF4 antibodies, meeting the definition of vaccine-induced immune thrombotic thrombocytopenia, or VITT. Laboratory testing on the remaining 13 individuals is ongoing. We continue to take these reports of side effects to vaccines, however rare, very seriously, and we consider these carefully when looking at the vaccine portfolio in Canada. Earlier this week, after Health Canada's authorization on May 5th of the use of the Pfizer-BioNTech COVID-19 vaccine for youths aged 12 to 15, the National Advisory Committee on Immunization, or NACI, recommended that youths 12 years of age and older without contraindications be offered a complete series of this vaccine based on clinical trials of the vaccine in this age group. It is up to the individual provinces and territories to decide when and how to incorporate this age group into the vaccine rollout, and many have already begun to do so. Vaccinating younger populations will help protect them, control the spread of COVID-19, and contribute to even broader vaccine coverage across the country. In addition, this week, Health Canada authorized the Pfizer-BioNTech vaccine to be safely stored at regular refrigerated temperatures, that is, 2 to 8 degrees Celsius, for up to 1 month. This change will help make vaccine distribution more flexible and may allow for wider distribution, ultimately getting even more doses into arms even more efficiently. I know we're all encouraged by recent developments like these. We can clearly see Canada's vaccination efforts expanding and accelerating in a big way. More than ever, we're looking forward to being able to safely gather with our friends and families and regaining some sense of normalcy. As detailed last Friday when we talked about public health measures post-vaccination, these better days and the gradual lifting of restrictions may be just around the corner if we keep up our good work. I thank Canadians for all the good work they've already done, and I ask everyone to keep going. For now, though we may be tempted this long weekend, we must continue physical distancing, wearing our masks, and following local public health advice, regardless of our vaccination status. Let's stay on track and keep case counts down so we can all have the safe summer we want. Thank you.
Bonjour à tous et à toutes et merci de votre Good afternoon, everyone. Thank you very much for attending this briefing session that we're having today on COVID vaccines in Canada. I am here with Brigadier General Krista Brody, Vice President of Operations and Logistics at the Public Health Agency of Canada. To assist us in answering your questions, we have with us Joelle Paquette from Public Services and Procurement Canada. This week, Canada's vaccination campaign has continued to soar. As of today, more than 19.6 million doses have been administered. It is very encouraging to see that over 55% of the eligible adult population in Canada has rolled up their sleeves. As of May 16, there have been 34 reports of blood clots with low levels of blood platelets following immunization in Canada with the AZ or Covishield vaccines reported to the federal level. Of those, 21 have tested positive for PF4 antibodies, meeting the definition of vaccine-induced immune thrombotic thrombocytopenia, or VTT. Lab testing on the remaining 13 individuals is ongoing. We continue to take these reports of side effects to vaccines, however rare, very seriously, and we consider these carefully when looking at the vaccine portfolio in Canada. Earlier this week, after Health Canada's authorization on May 5th of the use of Pfizer-BioNTech COVID-19 vaccine for youths aged 12 to 15, the National Advisory Committee on Immunization, or NAZI, recommended that youth 12 years of age and older, without contraindications, be offered a complete series of this vaccine based on clinical trials of the vaccine in this age group. It is up to individual provinces and territories to decide when and how to incorporate this age group into their vaccine rollout, and many have already begun doing so. Vaccinating younger populations will help protect them, control the spread of COVID-19, and contribute to even broader vaccine coverage across the country. In addition, this week, Health Canada authorized the Pfizer-BioNTech vaccine to be safely stored at regular refrigerated temperatures, that is, between 2 and 8 degrees Celsius, for up to 1 month. This change will make vaccine distribution more flexible and may allow for wider distribution, ultimately getting even more doses into arms even more efficiently. I know we're all encouraged by recent developments like these. We can clearly see Canada's vaccination efforts expanding and accelerating in a big way. More than ever, we're looking forward to being able to safely gather with our friends and families and regaining some sense of normalcy. As detailed last Friday, when we talked about public health measures post-vaccination, those better days and the gradual lifting of restrictions may be just around the corner, if and only if we keep up our good work. I thank Canadians for all the good work they've already done, and I ask everyone to keep going. For now, though we may be tempted this long weekend, we must continue with physical distancing, wearing our masks, and following public health advice, regardless of our vaccination status. Let's stay on track and keep case counts down so we can all have the safe summer we want. Thank you. I now invite Brigadier General Krista Brody to deliver her remarks. Thank you.
Good afternoon. I'm Brigadier General Krista Brody, Vice President, Logistics and Operations at the Public Health Agency of Canada. It's an honor for me to return to the agency. This organization has momentum. We are very much in the big lift. We are increasingly seeing high volume vaccine supply with a record number of vaccine deliveries this week. The National Operations Centre is humming along like a well-oiled machine. Collaboration with provinces, territories, Indigenous communities, and other government departments has set a solid foundation for the efficient distribution of vaccines across the country. It has set the conditions for success as we begin to operate at scale. These relationships are important as we position to receive vaccine doses in the millions on a regular basis. This week is a big week for vaccine supply. Over 2 million Pfizer-BioNTech vaccine doses have gone out in the past 3 days alone. Another 1.4 million doses of Pfizer-BioNTech are being distributed today and tomorrow, ahead of schedule, an advance on next week's deliveries due to the upcoming holiday on Monday. The remaining 600,000 doses, scheduled for the week of May 24th, are due in shortly after Victoria Day. For Moderna, today, we received 1.1 million doses that will be delivered to provinces and territories between now and Saturday. We continue working with the manufacturer on upcoming delivery schedules. We have also completed delivery of 534,000 doses of AstraZeneca this week. We are focused on the goal and will keep working tirelessly to provide vaccines to Canadians We are an integrated team of public servants and CAF professionals, resilient, agile, and completely committed to the mission of COVID-19 vaccine mobilization. In a single week, we will have surged from 20 million to over 25 million doses delivered across the nation. We are on track to deliver more than 40 million doses to provinces and territories by the end of June. It is a significant milestone. I'm proud to be back with the team and to play this small part in supporting such a monumental effort. Bon après-midi. Je suis le Brigadier Général Krista Brody.
Good afternoon. I am Brigadier General Krista Brody, Vice President of Logistics and Operations at the Public Health Agency of Canada. It is an honor for me to return to the agency. This organization has momentum. We are very much in the big lift. We are increasingly seeing high volume of vaccine supply with a record number of vaccine deliveries this week. The National Operations Centre is humming along like a well-oiled machine. Collaboration with provinces, territories, Indigenous communities, and other government departments has set a solid foundation for the efficient distribution of vaccine across the country. It has set the conditions for success as we begin to operate at scale. These relationships are important as we position to receive vaccine doses in the millions on a regular basis. This week is a big week for vaccine supply. Over 2 million Pfizer-BioNTech vaccine doses have gone out in the past 3 days. We are expecting another 1.4 million doses of Pfizer-BioNTech tomorrow, or today and tomorrow, ahead of schedule, an advance on next week's deliveries due to the upcoming holiday on Monday. The remaining 600,000 doses scheduled to arrive for the week of May 24th are due in Canada shortly after Victoria Day. As for Moderna, today we received 1.4 million doses that are currently being delivered to provinces and territories. We continue working with the manufacturer on upcoming delivery schedules. We have completed delivery of 534,000 doses of AstraZeneca this week. We are focused on the goal and will keep working tirelessly to provide vaccines to Canadians. We are an integrated team of public servants and CAF professionals. We are resilient, agile, and completely committed to the mission of COVID-19 vaccine mobilization. In a single week, we will have surged from 20 million to over 25 million doses delivered across the nation. We are on track to deliver more than 40 million doses to provinces and territories by the end of June. It is a significant milestone. I am proud to be back with the team and to play this small part in supporting such a monumental effort. Thank you.
Thank you, Brigadier General Brody. We will now open the phone line to questions. Please limit yourself to one question and one follow-up. We'll be taking your questions in both official languages. Nous demandons de vous limiter à une question et seulement une question suivie.
Please limit yourself to one question and one follow-up question, and you can use whichever official language you choose.
Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, la première question, David Turton, CBC News. Your line is open. À vous la parole.
Hi, I think this question is for Brigadier General Brody, but Dr. New, feel free. When will Canada have enough supply to accelerate second doses more aggressively and move beyond the one-dose strategy that is in place right now? And if you can respond in French, please, en français, that would be much appreciated.
It's Dr. New. Maybe I'll just start off to say, maybe to reframe your question. Canada does not have, quote, a one-dose strategy. We've always had the two-dose strategy. The issue, I think, obviously has been about sort of extending the dose interval between the first and second doses. So I think with obviously millions more of doses coming into the country very quickly, I think we're well on track to offer that second dose. Obviously the interval has been up to, the 16 weeks, but certainly can be a lot less. And I'm certainly starting to see that in many of the provinces and territories where they're booking. So I think we're on track to, as I say, shorten the interval, depending obviously on the supply. But I think I would just leave it at that and pass it on to Brigadier General Brody to respond as well. Thank you.
Thank you. I'd offer that we continue to push vaccines to the provinces and territories as soon as they become available in accordance with the allocations to allow the provinces and territories to roll out their vaccine campaigns in the manner that they determine best meets their population needs. Donc, on est en train de mettre l'accent pour faire avancer la distribution
we are
des
currently
vaccins
focusing on
vers les
distributing the vaccines in provinces and territories
dérouler leur programme de
so that they can
vaccination
roll
pour
out their
s'assurer que
vaccine
la plupart
program
des Canadiens peut accéder les
and ensure
vaccins
that Canadians
plus tôt
can
que possible.
have access to vaccines as quickly as possible.
Merci. Juste parce que
Thank you.
vous voulez que je répète ma réponse en français.
Would you like
aussi.
me
Je pense
to
que
repeat my
notre
answer in
approche
French?
ici au Canada, c'est toujours d'administrer les
I
vaccins
think here in Canada, our
qui ont
approach has
besoin des
always
deux doses.
been
C'est
to
toujours la
administer
stratégie.
two-dose vaccines. That's
L'enjeu était
always been our
l'intervalle entre les deux doses.
situation.
On a suivi dans toutes les provinces et territoires
This
les
has been done
recommandations
in
de
all of the
CCNI
provinces
de peut-être allonger
and
l'intervalle jusqu'à
territories.
16
We have
semaines,
followed the
4 mois,
advice
mais
that was given
avec
to
les
extend
millions
the
de
period
doses
to
qui
perhaps
sont en train
16 weeks.
d'être livrées ici au
But
pays, je
given
pense que
the doses
au
that we
fur et à
are
mesure,
receiving in
les provinces et
Canada, I
territoires sont
think
peut-être
that with
capables
time,
de
provinces
donner la
and
deuxième
territories
dose
will be
aux
able to
Canadiens et
give the
Canadiennes
second
peut-être
dose
plus tôt que
to Canadians
l'intervalle jusqu'à 16
earlier than
semaines.
expected.
Ça va bien, je pense,
In other words,
pour
less than
l'été
within these
à venir.
16 weeks. That's what we are hoping for the future.
Thank you. What question?
Yes. So Quebec is introducing an adequately vaccinated category. People who have had COVID and who will now be getting who've had COVID and will now be getting just one dose. What are your thoughts on this? And is this the direction we should be heading in? Can you also respond in French as well?
Okay, thank you for the question. It's a Dr. New. I think I'll take that one since it's a bit scientific and public health oriented. So, yes, we're well aware of what Quebec is pursuing. There is some evidence experience in other countries, but I would say that it's based primarily on sort of what we know with respect to vaccinology and immunology. And the fact is that if you do have natural infection, obviously your body does mount an immune response. And so I think the thinking in Quebec is that by having had that natural infection, in some ways it's like getting a first dose of a vaccine, which obviously is a different way of challenging or exposing the body to this virus. Obviously, a vaccine is not the virus itself; it's the spike protein, et cetera, and so on. So, with that, then by giving that one dose, in essence, the thinking would be that it would be sort of that second dose in a way of sort of priming again or sort of re-challenging the body with that first dose of vaccine, which in some ways is sort of that second sort of introduction or challenge to the immune system. So that's the thinking. I'm not aware that any other province or territory is also considering that. Certainly the current recommendation from NACI based on their analysis of the evidence is that people should complete a two-dose series of the vaccine, even if they have had COVID-19 previously. But as we all know, and we've said repeatedly, science continues to evolve, data continues to come forward from throughout the world with respect to the experience in other countries. And I think NACI and experts will certainly be live to looking at data and obviously adjusting any recommendations as appropriate in the future. Je pense en français, je pense que l'approche au Québec avec le vaccin, c'est que
with their vaccine is that for those who have had a natural infection,
ça peut activer comme le système immunitaire.
That can activate the immune system.
On donne une première dose de vaccin.
So if you give them a first dose of vaccine,
une autre stimulation de système immunitaire.
That was stimulating the immune system yet again.
L'approche, c'est que, OK, on a sûrement
so the approach
dose de vaccin,
is that, yes, people definitely need one dose of vaccine.
Qui n'a pas eu une infection naturelle.
Well, a second dose for someone who did not get a natural infection, you nonetheless need the second dose. But one dose of vaccine can be like the second vaccine for those who have had the natural infection. There's also that type of research going on in other countries, but we recommend the provinces and territories follow the recommendations of NACI to get to the 2 full doses. And that applies to all people, even those who have had a natural infection.
La science continue d'évoluer et
science continues to evolve,
les données probantes qui sortent des autres pays
and we're waiting for
les experts,
some statistics and results
sont toujours prêts
from
à suivre
some research,
les données probantes.
And certainly our experts are always willing to rely on reliable figures, and if there's something that we can modify for future recommendations, that will be done. Thank you.
Thank you. Merci. Our next question. La prochaine question. Hélène Buzetti, les Coop de l'information. Your line is open. À vous la parole.
Oui, bonjour.
Yes, good afternoon.
Que ça s'adresse à Mme Brody.
My question is for Ms. Brody.
AstraZeneca. Donc, je sais
it pertains to the AstraZeneca vaccine. I know we're getting about 500,000 doses soon.
On en recevra combien d'ici la fin juin? Donc,
how many will we receive by the end of June?
Est-ce que ça sera
in other words, by the end of the second quarter, will we receive enough to give a second dose to all of those who had AstraZeneca as their first dose?
Merci.
Thank you.
Je peux commencer après.
Yes, I will start to answer that question.
Donc, je peux confirmer qu'on a distribué
I can confirm
de 500,000 doses
that we have distributed more than 500 million doses this week.
100,000 dans notre entrepôt fédéral.
There's still 100,000 in our storage rooms, and we are trying to ensure that all Canadians
who
want to have AstraZeneca for their second dose will be able to do so. They will get that type of vaccine. Joëlle? Thank you very much for the question. With regard to the number of doses we're supposed to get by the end of June, we're working with AstraZeneca right now on the bilateral agreement, and we're expecting 2 million doses by the end of June. Thank you.
Et c'est Dr. New, peut-être
this is Dr. New.
Ajouter peut-être une perspective de la santé publique.
I'd like to add a different perspective from public health. We know that so far, about 2.1 million Canadians have received a first dose of AstraZeneca, and we are continuing to offer AstraZeneca to those who got AstraZeneca as the first dose. Not all those who received the first dose are going to want to get a second dose of AstraZeneca. We don't know what the exact situation is going to be, and we know that studies are underway. And while waiting to receive the results of clinical trials in the UK and US, we are moving forward with the recommendations from NACI. And we're trying to determine whether it's effective and safe to offer a different type of vaccine to those who received AstraZeneca as their first dose. You said that 100,000 doses are in storage right now. Could you confirm that? But you said 2.1 million Canadians received AstraZeneca as their first dose, and now you're talking about 500,000 that were distributed, 1 million that are coming, and 100 million that are in storage. That's 1.6 million. So we're still missing 500,000 doses to make sure that all Canadians who got AstraZeneca as a first dose will get it. So I was wondering if there were plans to get to 2.1 million doses, and generally speaking, is there an attempt to get the 20 million doses of AstraZeneca that we were supposed to get in the next quarter? Well, thank you for the question. We have a bilateral agreement with AstraZeneca for 20 million doses, but the 1 million doses that will be delivered is one of the first deliveries. We're expecting more in July. We are working with AstraZeneca to confirm the delivery date for June, after which we will continue receiving AstraZeneca doses. The situation is constantly evolving, and we are always trying to meet the needs, the future needs of Canadians. I don't know if my colleagues want to add to that. But when it comes to the doses and the number of doses, we do expect it to get enough by June. Thank you.
Nous allons passer à la prochaine question. Operator, next question.
Thank you, merci. Our next question, Mia Rabson, the Canadian Press. Your line is open. À vous la parole.
Hi, yeah, I'm wondering if you could talk about the deliveries of AstraZeneca to the provinces. We got 655,000 doses in the country. So I'm wondering if any provinces said they didn't want any doses, if some said they didn't want as many as they would normally get. If you could break down sort of how that, why we still have 100,000 left from that shipment.
Sure, Brigadier General Brody here. So certainly all of the allocation has all of the shipment has been allocated to the provinces, and what that allows them to do is draw against that allocation to best support their vaccination programs. And there is the option with the AstraZeneca to retain a portion of that allocation in our federal facility, pending the right timing and the right plan for each of the provinces and territories. So at this point in time, several of the provinces have exercised that option with respect to their own plans, and that accounts for the amount that's currently sitting in our federal depot. Thank you.
Province say they didn't want any doses of that. And I'm also curious, in terms of this new study that Canada is launching, the Immune Task Force launching on mixing and matching, is NACI expected to be able to provide advice before we get Canadian data on this? And when will we get some guidance on when second doses can go forward? I think there's a lot of anxious people wondering what's going to happen.
It's Dr. New. I can maybe answer the question about NACI and the Canadian study. Certainly, the Canadian study is important. It adds to our knowledge base in terms of, as you say, the mixing and matching. But certainly, my understanding is that based on sort of the good trials underway with lots of people involved, both in the UK and from other countries, that will be sufficient for NACI in terms of analyzing the data available and then making recommendations. And I think. As I said, I think probably in French just a few minutes ago that we're tracking for NACI to maybe give a recommendation or guidance with respect to the mix and matching, probably sort of early June, first week or so. But obviously, with Canadian data and Canadian studies and other studies that might also be undertaken in other parts of the world, that'll also, I think, be taken into account as they unfold and more data becomes available. So certainly, I think as we've seen. Science continues to evolve, and I think we need to follow the science in terms of data as it becomes available. Thank you.
Thank you very much.
Brigadier General Brody here. The first part of your question was partially. The first part of your question was partially cut off, but we confirm that our practice is for those provinces that indicate that they're not able to use the full measure of their apportionment, then we can make arrangements to shift those allocations between provinces to ensure that as many Canadians as possible can benefit from the allocations that we do have. Thank you.
Thank you very much. Operator, next question. Prochaine question.
Merci. La prochaine question, Geneviève Normand, CBC Radio-Canada. Your line is open. À vous la parole.
Oui, merci de prendre ma question. La première s'adresse à vous, Dr. New. En fait, c'est à propos
My first
de la
question
frontière.
is to Dr. New with regard to the border.
L'assouplissement des mesures à la
When do you
frontière,
think the measures are going to be softened at the border,
général, par exemple,
especially
pour les gens qui
between
veulent
the
rentrer au
Canadian
Canada,
and
qui ont
US
déjà
border?
reçu les 2 doses
And what
du
about for
vaccin,
those
à
Canadians who have
l'étranger, par
already
exemple? Alors, à
received
quand est-ce que
their
vous
2
pensez
doses
sur
of
le plan
vaccine
sanitaire que ça peut être
overseas?
assoupli? Et
When
une
do you
réponse en
think
anglais aussi
the
très rapide.
borders are going to be slightly
Merci.
open?
Merci pour la question.
Thank you very much for the
C'est
question.
un enjeu actuel, c'est sûr.
That
Et,
certainly
on
is
continue
a big issue
d'examiner
right now.
les données
We
probantes. Il y a
continue to
toutes
look
sortes
at the
d'aspects,
evidence.
même techniques,
There are
parce que
all sorts
même
of
après la
aspects, even
vaccination, on sait
technical
qu'il
aspects.
n'y a aucun
After
vaccin
the
qui est
vaccine,
100% efficace.
no
Qu'est-ce qu'on
vaccine
fait
is
avec
100%
peut-être
effective.
les personnes qui restent
So
encore
what should we
susceptibles,
do
même
with
après
people who
2
remain
doses de
susceptible
vaccin?
to
Aussi,
infection,
des autres
even after
questions,
2
c'est quoi
doses
la
of vaccine?
durabilité de l'immunité, de la
And
protection
secondly,
contre
what is the
contre
duration
la
of the
COVID-19. Il y a
immunity
toutes sortes d'aspects
against
comme ça. Mais je
COVID-19
pense que
once you've had the vaccine?
on est, comment dire,
There are all
encouragé
sorts of aspects that we have to look
la
at, but
situation
we are
ici au
encouraged by
Canada,
the
mais aussi aux
situation
États-Unis
here in
avec
Canada and in the US.
l'épidémiologie, mais aussi, comment dire,
When we look at
le
the
déploiement des vaccins
epidemiology
dans les 2 pays. Je pense
and
que
also
c'est les autres aussi.
with
Je
regard
pense
to the
que les
vaccine rolled out
ministres
in both countries.
qui sont en train d'avoir des négociations.
Certainly,
Moi,
the
avec
ministers
Dr.
are
Tam et les autres, on
negotiating
donne
all of
toujours
this.
nos
Dr. Tam and I
conseils, recommandations
always give our
avec une
advice
perspective de
and
la
our
santé publique, mais
recommendations
on sait que
with a
si on
public
parle de
health
l'ouverture de
perspective.
la frontière
But if you're
entre
talking
le
about
Canada
the
et les
opening
États-Unis,
of
mais aussi
the
des autres
border with the
considérations, pas
US,
seulement
you have
la
to take other
perspective de la santé
considerations
publique.
into account, not only
In
public
English,
health.
the whole issue of opening up the border with the United States, I think obviously it's a very live issue. From a technical public health perspective, we're certainly looking at the data. I think it looks very good in terms of the situation, epidemiologically, but also in terms of vaccine rollout, both in the United States and in Canada. However, to be quite honest, there are some technical questions, unanswered scientific questions, with respect to Canadians who might have, their 2 doses of vaccine and what could or should happen to them when they come to Canada. Obviously, there's a sort of a quarantine regime in place right now. The fact is, we know that there's no vaccine that's 100% effective, and so even with people receiving 2 doses, a certain percentage will come through and still be susceptible, maybe still be able to transmit and so on. And then, of course, even the question of durability. How long does immunity last, et cetera, and so on. So there's some technical questions, but beyond that, I think certainly the role of myself, Dr. Tam, and others is to give our best advice, the public health perspective to our minister and cabinet. But as we know that the issue of opening up the border with the United States, there are other considerations beyond just purely technical public health. So I think I'll just leave it at that. Thank you.
Très bien, merci. Tout à l'heure, ma collègue vous a parlé du vaccin d'AstraZeneca. Moi, je voudrais vous parler du vaccin
Earlier on,
de
my colleague
Moderna.
asked you a
Vous avez
question
dit
about
tout à
AstraZeneca,
l'heure,
and I would
la
like
médiateur
to ask you
Brody, vous
about
avez dit que nous
Moderna.
continuons à travailler avec le fabricant pour les
You
prochains
said
calendriers
that
de
Canada is
livraison. Mais
working
sauf
with
erreur, il me
the
semble que ça fait
manufacturer
plusieurs fois qu'on
on a
attend justement
delivery
des
calendar.
nouvelles avec Moderna. Alors,
But I was wondering what the news was with
qu'est-ce qu'il en
Moderna.
est? Est-ce que, par exemple,
What
il
is
y a une
happening with
possibilité
Moderna?
qu'on puisse avoir une entente avec
Is
un
there
fabricant
the
américain pour
possibility that
recevoir
we're
des
going to
vaccins
have
de
an
Moderna?
agreement
On
with
en est où dans les
an
négociations,
American
dans tout le
manufacturer
travail
to
qui se fait
get to
dans l'ombre?
Moderna? What is the situation with that right now?
Again, in English would be great too.
Donc, je peux commencer en confirmant que
I will
cette semaine,
start
on a
by
reçu
confirming
1,1 million de doses ce matin et
that
on
we
est en
received
train
1.1 million doses this
de les
morning,
livrer aujourd'hui et demain
and
et
today and tomorrow we will be delivering those,
le samedi
as
aussi.
well as
Et on
Saturday.
est en train de continuer nos
Furthermore,
communications avec le manufacturier
we are
pour
continuing our negotiations with the
confirmer
manufacturer
la prochaine
to confirm the next
Joanne?
delivery.
Merci. Oui, comme Général Brody a mentionné, on
Yes,
continue à
as
travailler
Brigadier
avec
General
Moderna
Brody
sur son
said, we
calendrier de
continue to
livraison.
work with Moderna
C'est
on the
certain que notre
delivery
objectif, c'est de
calendar.
recevoir le plus
Our
de doses
objective
possible au
is to
Canada le
get
plus
as
vite
many
possible.
doses
Et
as possible here in
pour ce
Canada and as quickly as
faire,
possible.
on travaille avec
To
eux
do
pour,
so,
afin d'obtenir des
we have
doses
been
de leur
working with
chaîne
them
logistique mondiale.
to
Donc, s'il y a
get
des
some doses
possibilités,
from their global
on
logistics
l'explore
change.
et on va y aller de l'avant. In English,
So we are going to go ahead with
continuing to
working
work
with them.
Moderna on their delivery schedule and firming up that delivery schedule. The objective is really to get as many doses in Canada as soon as possible, and we're working with them to and other suppliers on their global supply chain, if available. Merci. Thank you.
Dr. New, I was just thinking about the answer. Sorry, the answer I was giving before, and so to the question about Canadians, with 2 doses of vaccine, could or should they be allowed in, et cetera, and so on. I think a lot of it also depends on sort of where we are with our vaccine coverage in Canada, because it's not so much about individuals who might be coming into Canada from abroad, what their vaccination status is. It's about how comfortable we are in terms of is the situation controlled in Canada with the epidemiology, as well as the vaccine coverage. Do we feel that our population as a whole is well protected? And that's why we've been talking about that 75% goal in terms of 2-dose coverage in Canada. Hopefully, even more will have received the vaccine. So those are some of the factors in play as well, besides the other considerations. So I'll leave it at that. Thank you.
Our next question. Prochaine question.
Thank you. Merci. Our next question, Mike Lacuter, Global News. Your line is open. À la parole.
Yes, hi. This might be for Brigadier General Brody. I wanted to ask you, how many doses of the AstraZeneca vaccine are at risk of expiring either at the end of May or June? And what are you going to do with them? Will they go to waste, or will you make sure that they get sent to other countries and or provinces?
At this point, we're tracking a very small number of doses that will expire at the end of May, and we're working actively with the provinces to ensure that they can be used in a jurisdiction that has the capacity to administer those before their expiry date. The remainder of the AstraZeneca doses that were distributed this week have an expiry towards the end of August, so the provinces have ample opportunity to work those into their distribution plans, into their vaccination campaigns. And if vaccines do time expire, then then we will dispose of those in accordance with Health Canada and public health best practices, monitor that wastage while making every effort to ensure that as many vaccines as possible are used to vaccinate Canadians.
Sorry, I just wanted to get a precise number on the small amount when you said a very small amount, but also for my follow-up, I think it's more for Dr. New, following up on a question of my colleague. Many people are waiting for that guidance on the dose mixing, especially when it comes to the second dose of AstraZeneca. Will it, I know you said maybe at the beginning of the month, but this is also at a time when we're looking at expiring AstraZeneca vaccine. So how worried are you that the lack of any kind of guidance is contributing to this vaccine hesitancy and then possibly contributing to vaccine wasting?
I can't really speak to, thank you very much for the questions, Dr. New. I can't really speak in terms of sort of the vaccine wastage. Obviously, that's a logistical administration issue with respect to the vaccination programs in the individual provinces and territories. What I can say is that, let's focus on the AstraZeneca vaccine and those Canadians who have received that first dose. We've said it before and I'll repeat it. I think, they've done well. They've obviously protected themselves by getting the vaccine. They protected their family and their loved ones. And I think they've contributed overall to what we say our collective sort of herd immunity and decreasing the risk of further community transmission. With respect to getting the second dose, if you look around the world, especially in the United Kingdom, millions of people have received a full 2-dose regime of the AstraZeneca vaccine. And so I think, if you look at that, it's always a matter of, I would say, a sort of a full information, full informed consent, and in some ways, a personal risk tolerance. So you look at the fact that millions of people have received it. It's fine with a 2-dose regime. Here in Canada, obviously, we're alive to the issue, and you've seen it in other countries as well as here, that there is this rare event. It's rare, but if it does occur, it is serious with the blood clots, and so that's why the provinces, because there is, I guess, in some ways, another option with the mRNA vaccines. They put a pause in terms of the first dose of the AstraZeneca vaccine. So what I would say is that, individuals, I can't speak for the provinces in terms of how they're offering potentially that second dose under which interval. But I think that's certainly one option. And I guess for those individuals who have received the AstraZeneca vaccine, they may well have a second option, which is hopefully forthcoming with a recommendation from NACI with respect to, say, mixing and matching. All I can say at this point, looking at the sort of the preliminary results from studies around the world, especially from the UK, that the early results from what I've seen are very promising. So I think it bodes well for individuals who have received the first dose of AstraZeneca, having that choice. And of course, at the end of the day, it comes down to making an informed decision.
Thank you, Dr. New. Operator, next question. Prochaine question.
Thank you. Merci. La prochaine question, Catherine Lévesque, La Presse canadienne. Your line is open. À vous la parole.
Oui, bonjour à vous tous.
Good afternoon, everyone.
Je voulais revenir sur une question qui avait été posée par ma collègue Mia Rapson.
I'd like to go back to the question asked by Mia Rapson. It was for Brigadier General Brody.
Nous donner une liste,
I was wondering whether you could give us a list of the provinces
en fait, à recevoir les
that have requested
55 000
the
doses de COVAX. Je ne sais pas si vous pouviez nous donner les
COVAX doses. I was wondering whether you could give us
à chacune de ces provinces.
an idea of how many doses have been sent to each of the provinces.
Je n'ai pas les numéros précis.
I don't have the specific numbers with me.
Les tables d'allocation sont dans le domaine public
when it comes to allocation, you can see that on the website.
Tableau pour AstraZeneca.
governmentofcanada.ca.
Les allocations
with regard to AstraZeneca.
Merci.
You have the allocation for each province.
Ah, OK. Ça semble être une nouvelle parce qu'on fait la demande à l'Agence de la santé publique et on n'a pas la réponse.
That's news to me. We've made the request to Public Health and didn't get the answer. My next question is for Dr. New. With regard to another vaccine, Johnson & Johnson, what's happened with the 300,000 doses that are currently under study? And why is it taking so long to get an answer with regard to those doses?
Merci pour la question. Oui,
Thank you for the question. That's a good question. All I can say is that I know that it is Health Canada that is still looking at the data and continue to have discussions with the manufacturer in the United States. That's all I can say right now. I am aware of that much information. They're continuing their work, and I'm sure that a decision will be made soon.
Merci beaucoup. Operator, next question.
Thank you.
Prochaine question.
Thank you. Merci. Our next question, Marieke Walsh, the Globe and Mail. Your line is open. À vous la parole.
Good afternoon. My question is for Brigadier General Brody. You mentioned in your opening comments that Canada is expecting to receive more than 40 million doses by the end of June. Previously, we've been told that it's at least 48 million doses. So can you please specifically tell us how many above 40 million you're expecting by the end of June, and what is the breakdown between the different types of vaccines in that total delivery by the end of June?
So certainly when we speak to numbers from a distribution perspective, we're talking about either doses that have been delivered or orders that have been confirmed or in the process of the ordering and shipping process. So from a distribution perspective, we can confirm up to 40 million doses by the end of June. That includes this week's deliveries of Pfizer, of Moderna, of AstraZeneca, and it includes the confirmed projections for the Pfizer deliveries between now and the end of June. Thank you.
If I might add on the projection or expected doses, we're still working with Moderna, as was mentioned earlier, on determining their firm delivery over the month of June. And then we're working with AstraZeneca on 1 million doses by the end of June. Thank you.
Thank you for that extra information. I think my question maybe then for follow-up is both for Madame Paquette and for Brigadier General Brody. Brigadier General, you just said up to 40 million doses by the end of June, which is, again, different than more than 40 million doses. So, again, can there be more specificity around what we are actually expecting by the end of June? And for Madame Paquette, can you explain a bit more what you're still trying to confirm? Is it now incorrect to say that Canada will receive more than 48 million doses by the end of June?
So I can speak to just those numbers where we have confirmed deliveries in the pipeline, and that'll bring us to around the 40 million point, maybe slightly lower, maybe slightly higher. And should additional natures of vaccines come online as we move through the month of June, and then that will add to that number and continue to push it upwards. Over.
Thank you. I just want to say that from the beginning, our goal has been to have enough doses to vaccinate eligible Canadians by the end of September. And I could say that we're on track to meet that goal. Thanks.
Thank you very much. Operator, next question.
Thank you. Our next question, Charlie Pinkerton, iPolitics. Your line is open. À vous la parole.
Hi. It was about a month ago when the Public Health Agency of Canada disclosed to one of the parliamentary committees showing that it had conducted a survey of the provinces and territories to see how many vaccine doses they were actually capable of delivering on a weekly basis. The number there was 3.1 million, which we're going to surpass pretty quickly. We have as of this week and every week going forward, at least for the next month, it seems like Canada will receive more than that amount of doses. So I'm wondering, is that number still accurate? Perhaps this is a question best for Brigadier General Brody or Dr. New, but is that number still accurate for what you know that the provinces and territories are actually capable of administering in a week, or are we going to, or are they able to do more at this point?
Brigadier General Brodie here. I'd offer to start that the provinces and territories continue to build their capacity every single day, their capacity to conduct immunizations, to rally healthcare practitioners, to support those efforts, to project their immunization efforts further and further into the communities. So certainly they have ample capacity and continuing capacity to roll out the vaccination campaigns across the country. And we continue to work to make sure that they have the ancillary equipment, the cold chain equipment that they require to continue scaling up as vaccine supply becomes more and more available.
Yeah, and it's Dr. New. Maybe I can just add to that. I think it really speaks to, the wonderful sort of innovation and inventiveness by, the provinces and territories. There's been all sorts of things we've seen in news, pop-up clinics, clinics at night, all sorts of wonderful ways that, drive-by clinics, etc. So that, it's amazing, how provinces have been innovative in terms of offering and increasing our capacity, and even in terms of human resources, the vaccinators. I think there was a certain sort of workforce that we thought we start with in terms of, be it nurses and so on, but more and more people have become trained as vaccinators. So that's on the one side, and I think it also speaks to the demand. So that's great. Canadians are hungering; they want they're thirsting for their vaccine doses. So I think the fact that provinces and territories are upping their games in terms of capacity to deliver vaccines, and there's actually the demand to get the vaccines, I think speaks well for everyone in terms of our vaccination effort. Thank you.
Thank you. Follow up?
Yeah. So how many vaccine doses per week then are you aware that the provinces and territories are capable of delivering at the moment? Or administering, rather, sorry.
I'm not sure Brigadier General Brodie has more exact figures. I've got obviously the total figures of vaccine doses administered. I don't know if I have the breakdown in terms of provincial weekly sort of administration data. That obviously changes. I think even a week to week. As more doses roll in, and the provinces and territories continue sort of to enhance their capacity. But certainly we can look at what data is available sort of afterwards, and certainly provide you with what we have at the federal level.
That would be appreciated.
And I think that the provinces and territories would be pleased to speak about their own capacities and efforts to scale up their administration capacities. From a distribution perspective, we're really focused on distributing as many vaccines as we have available that come available to the Canadian population, and distributing those in a manner as effectively, as efficiently, and safely as possible, so that they can be administered to Canadians.
Thank you very much. We have time for one last question. Dernière question, opérateur.
Thank you. Merci. Our last question, la dernière question. Rachel Haynes, CTV News. Your line is open. À vous la parole.
Hi there. I'd just like to follow up on what my colleague Marika was asking about why we're no longer able to confidently say that we're going to be getting 48 million doses. Has something changed with the shipments or with the manufacturers? Is it Moderna that's not meeting its commitments that is forcing us to no longer meet that 48 million target?
Thank you for the question. In mid-April, we did report that Moderna was expecting Canada would see disruption of its deliveries as the company was working on scaling up production capacity. And right now, we're working with Moderna to firm up their delivery schedule, and we will be able to provide further detail once we have a better confirmation of their delivery capacity on a weekly basis. Thank you. Or on when we know when the next delivery arrives. Thank you.
Voilà.
Thank you. And my follow-up question is to Brigadier General Brodie. This is your first appearance in your new role at Public Health Canada. Obviously, after Major General Danny Forte had stepped aside. So I would just like to know how are you feeling in taking over in his role, given the circumstances of his departure and also in the overall context of what's happening in the higher ranks of the military?
Thank you. So I'm feeling many things. So I'm feeling excited for the opportunity to be able to lead a logistics organization as they're involved in such a monumental effort on behalf of Canada and Canadians. I'm honored to be working with the team here again. And I think I would like to acknowledge that in these times, there are many, many things that we need to be doing within the Canadian Armed Forces and within society at large to ensure that our behaviors, our attitudes, our beliefs align with the better values of the profession, align with the values and the ethical principles that we uphold as Canadians, and that we make every effort to advance those efforts to ensure that we are being the best Canadians we can be in every facet of our lives. Thank you.
Thank you, Brigadier General. That will be all for today's technical briefing. C'est ce qui met fin au briefing technique pour aujourd'hui. Bonne journée.
Thank you. Merci.